Hello, and welcome to Timing is Everything, a program of Care Dimensions. My name is Mary Crowe, Director of Professional and Community Education. Today, we have the pleasure of having attorney Arthur Skarmeas with us. Arthur, welcome to the show.
Thanks for having me, Mary.
Yeah, we're going to talk today about advanced directives, which is a very important topic. April is actually National Healthcare Decision Month, so there's a lot of focus on this, but there should be focus around the whole year around this topic, Arthur. So before we jump in, tell the audience a little bit about yourself.
Well, my name's Arthur Skarmeas. I'm an attorney specializing in estate planning and everything in and around that, up in Topsfield, so local, and I've been doing it for more years than I'd like to remember at this point, but it's been a while. So that's basically me.
Remember or admit?
Either, yeah.
Well, we're really thrilled that you're here with us, and this is an area of focus for you, and this is very important. So let's start, Arthur, by talking to people about what is an advance directive.
So an advance directive really is something that you would sign, you would want to execute for the purposes of making determinations as to how you want to be taken care of in the event that you become seriously ill, terminally ill, without and you've reached the point where you really don't have any ability to have any further meaningful life, and you're really just being kept alive by machines, basically.
Yeah. And
so an advance directive really is to just kind of lay out what you want done in that situation, so that your wishes will be followed.
Yeah.
And if you don't have something in place, and it goes back to all of estate planning, if you don't have things in place when you either become incapacitated or pass away, then you don't have your directions as to how you want things handled, and it becomes left up to other people. And of course, sometimes in those situations, there could be multiple other people who have disagreements as to how to handle certain things, and it can create a lot of anguish and angst for, obviously at this point, the family, because you as the person that has lost the capacity or lost the ability, at this point you're not really involved anymore, but you've now left it open for things that can be unpleasant.
Absolutely. And I like people to know too, Arthur, that really in the state of Massachusetts, if you do not have a healthcare proxy, it doesn't just defer to family. We're one of the few states. And so that concerns me too, because it can go to guardianship.
Well, one of the things that I always tell clients is that two of the most important documents that I will do for clients, but also two of the most simple documents that I will do for clients, are the healthcare proxy and the power of attorney, and we can talk more specifically about both of those as you would like. But the most important part of those documents are, well, twofold. Number one, you're designating who you want to make your decisions for you when you're unable to. But more importantly, if you don't have those documents and something does need to be done for you, then the only option in most cases is that somebody needs to go to court to get appointed as either a guardian or a conservator or both.
Right.
And in that particular situation, it's not something that can be done quickly. It's a process. You're dealing with the probate court in Massachusetts, and as well as they try to do their jobs, they're inundated with filings, and it takes a long time for things to move through the process. B, it costs a good amount of money to do that. And C, you don't know who's the person that's going to go over and seek to be the guardian, or maybe there'll be multiples, which could create even a bigger problem.
Right.
So you don't want to leave it up to the courts. I mean, the courts are there for a reason, and they are there to do their best to solve these problems if it does come up. But you don't want to leave it up to the courts, and you don't have to leave it up to the courts. If you take the time, and it doesn't take a lot of time, to appoint people when you're able to appoint people.
Right, exactly. And what I like people to understand too is, because people think you have to wait until you are advanced in age or infirmity, that sort of thing. 18 and over.
I mean, I tell people they should do it as soon as they become of 18.
Right.
So obviously that's the age of majority.
Yep.
And while things are unlikely, the things that happen that cause these to be used are obviously more likely to occur the older you get. It doesn't mean that they can't happen when you're 19, 20, 21, and then you face the same issues. So, it's important. These are two very simple but important documents that everybody should do as soon as they reach the age of 18.
Right.
And you don't want to leave it up to the system, because again, it's not efficient. And you don't have the control.
Yeah, and I do think that we're still a death-denying society. We don't want to talk about this stuff. I think that some people feel like they lose control by filling out some of these documents. We're actually taking control. Absolutely
taking control. You're basically appointing the people that you want to take care of things for you when you can't. And so with the healthcare proxy and the power of attorney for that matter, it's not a question of death. It's a question of becoming incapacitated. And sometimes that incapacitation is short term.
Right.
It's an accident.
Yep.
It's a surgery, and you're on medication, and it takes a little while for you to be able to come back, but something happens in that particular time period.
Yeah.
So what you're doing is you're controlling your situation. You're setting up the people that you want, and you can of course talk to those people and make sure they know what your wishes and desires are if certain things were to happen. But you're keeping control. You're totally in control.
Yeah.
If you don't do them, you do lose control, because you're now leaving it up to somebody else, somebody that you don't know.
Right.
I mean, you may know them, but you don't know who it's going to be.
Right.
And the court system to take care of things that need to be taken care of.
Absolutely.
Sometimes in an emergency situation, also hospitals, doctors, medical people will have to take certain actions if there's nobody appointed, because they have to do it anyway.
Right.
And so again, you don't have you control. It's the opposite of the question that you asked. It's the opposite.
Exactly.
You are maintaining control by doing them. You're not losing control.
That's right. So let's break them down, because again, in this advanced directive category, under legal documents, we have healthcare proxy, durable power of attorney, living will, with the caveat that living will is an important guideline, but yet it's not a legal document in the state. So let's talk about each one, Arthur. So the healthcare proxy.
So a healthcare proxy is a document where you appoint the person that will make your healthcare decisions if you are unable to, as determined by who you're being treated by.
Right.
All right. It's not just if you don't feel like making decisions. You have to be unable to make your own decisions, and many times it's a temporary thing. Mm-hmm. But oftentimes, especially for older people or people that dementia, Alzheimer's type situations, it becomes a permanent appointment. And so whoever you appoint, if you can't make the decision, the people that are treating you will go to that person. And oftentimes I always tell clients that you want to have a primary and a backup in case something is going on with the primary.
Yep.
And so they will go to that person and they will say, okay, this is the situation, this is what we recommend, but you have to make that decision, and then that person, your appointed person, would be able to do that. The other thing that's important about the healthcare proxy is that the person that is appointed is able to get all of the medical information that is necessary to make the decision.
Yep.
So this information would normally be blocked through the HIPAA laws, privacy laws, but the healthcare proxy obviously is able to bypass that and be able to talk freely about what the medical situation is and get all the information that they need to do that.
Yep.
Without that, again, you would be left with without somebody to make the decision to get the information. So that it's important that you have that in place.
Absolutely.
Again, and that's what the healthcare proxy does.
Yeah. And people can fill out a healthcare proxy is a legal document. It doesn't have to go through an attorney.
Nope.
And it's legal, right?
Yep.
So and the document itself is the healthcare proxy. When you're talking, because people say, oh, so-and-so's my healthcare proxy. No, they're your agent. And we're going to talk about that in a second too, about how to choose that person. And I like how you keep wording this, because really, when you're choosing this person or persons, these are people who should be speaking on your behalf. They should be your voice about what your wishes are, not deciding what's important to them.
Correct.
So,
Right.
so with the healthcare, and if they are going to go through with this, I always say I would prefer that they use a lawyer that's well versed in advanced care planning, or elder law, or advanced care planning and that sort of thing. A lot of times people will just go to anybody, but there's there's changes with this.
Yeah, I mean, with regard to the healthcare proxy, it's statutorily based. We have a very specific statute in Massachusetts on which we base the documents. If you don't have one and you go to the hospital for some type of an elective procedure, they will probably put a form in front of you and tell you to fill it out, and that's better than not having it. Yep. At that point, they will say, pick somebody, fill out the few things you have to fill out and sign it, and at least you have something in that situation that you can use. So, and the downside of that obviously is that you haven't really had a chance to talk to anybody about the fact that you're appointing them, and you're doing it, at the very last minute. But it's still okay because you've done it. When we do it in the office, we do it and we kind of make sure that everything that is necessary is included. Make sure you have your primary, your backup. Kind of advise people to talk to people a little bit about it before you make the choices. Yep. Also, we also and most lawyers that do what I do would also maintain them in their office. So they can shoot them over to a hospital if necessary. Yep. And so it's better to have it done ahead of time and have it in your toolkit, so to speak.
Sure.
But the other side is that if you happen to be in an accident and you're not conscious when you go to the hospital, you can't do that. And so not having it ahead of time prevents you from now having one to make your decisions.
Right, right. And when people, so let's talk about when people are filling these out, choosing a healthcare agent. I think this is important. And when I talk to people, I say, please choose them with your head and not your heart, because people automatically assume they have to pick the person that's closest to them.
Mm-hmm. Yeah, I mean, obviously, spouses will usually pick the other spouse, which makes sense. Sometimes when people get older, they don't pick their spouses because they don't want to put that burden on the spouse at that point, and maybe they have kids or whatever it might be. But what you want to do, I think the question often comes in a lot with the clients that I see is, as your kids get older, if you have kids, you're usually going to pick one of your kids to do this. The question then becomes, some of them will say, well, I'm going to choose Billy because he's the oldest, or I'm going to choose Joe because he lives the closest. Mm-hmm. None of those are really the best reason to do it. It's really the person that's best equipped to handle dealing with both gathering and going through the medical information, and more importantly, the emotional aspects of it. Right. Some people aren't good with somebody that's in a situation where they're maybe very ill. Some people are better. So you kind of gotta, and you shouldn't feel bad about picking one over the other. You just make the best choice that you have, and you want to talk to, if it's within the family, you want to talk to the family and say, this is what I'm doing, just so they know.
Yeah.
If it's outside the family, if you don't have kids, it's even more important to talk to the people that you're thinking of choosing, because you want to make sure that they understand what you want, and also you understand that they're capable of doing it. It's a little easier when you're dealing with your kids because you know your kids so well. But some people don't have kids, and so you have to go outside, and you definitely want to have that discussion, and also make sure they'll do it. Right. Because just because you choose somebody, if you've never told them and that they don't want to do it, they could always say, no, I'm not going to do it.
Exactly. So, and I think those are the questions. So are you willing to serve in this capacity? And secondly, here are my wishes. Are you willing to abide by them? I think those are two important things. And I do think the conversation about what one's wishes are is equally important in a lot of ways. And a lot of times people aren't doing that. No. I mean, I haven't had it happen too often. But I have had a couple of instances where they haven't talked to the person that they've chosen at all. Yep. And then the person shows up at my office saying, what am I supposed to do? Or I really don't want to do this. Yep. Yep. So
it's important as important as it is to get the documents done, it's important to make sure you talk to the people that they want us, they'll take these roles on.
Yeah. These are state to state. The other thing too is there are just a couple of little conditions about who can't serve in that capacity.
Yeah, I mean, for the most part, in Massachusetts, whoever you choose can serve unless they are not either A, old enough, or B, have their own capacity to make
Yep.
decisions.
Yep.
There's no real limitation otherwise, as long as they're over the age of 18 and have the ability to make reasonable decisions.
If it's somebody that works in a facility, though, that's one of the things too, right?
Depends.
Unless they're related.
If they're related, it's okay.
Blood marriage, adoption,
Yes.
yeah.
If they're not related, then you don't want to choose somebody, but more importantly, the person should not
Correct.
accept it.
Yes.
Okay. But the vast majority of people have a relative
Yeah.
that's on there, and if it's a relative, it's okay no matter where they work.
Yeah. Yes. Yep. I do have people ask me a lot. There are those people out there that just don't have anyone. They don't have family. They don't even know who they can choose. And they say, well, what do I do? And I say, is there any trusted human being in your life that you feel?
There's no real easy answer to that.
Yeah.
Because there's not a like if you need a guardian and you don't have if the family needs a guardian for you or for somebody, and you don't have somebody that you're comfortable with, you can go to court, and the court has guardians that they can appoint for you. That's not the case with a healthcare proxy.
Yeah.
So it has to be somebody that you choose. There's not a bullpen of potential healthcare proxies that you can go choose from.
Yeah.
So it is and I've had a recent client that had this particular situation, and it sent her off to really kind of talk to a few people in her life and she was able to I think you'll find that if you talk to people, even if they're not your brother or your sister or your child or a very close person, but they are somebody that you know well.
Yes.
I think you'll find that most people would be willing to take on that role.
Right.
So in this particular case, she went out and talked to a few people and actually found that they were all willing to
Wow.
serve, and so she chose the person that she thought would work best.
Oh,
so
that's great.
yeah, you have to hopefully there's somebody.
Right.
Hopefully there's somebody.
Right.
It can be tough, but I don't think I've found a situation yet where somebody couldn't come up with a healthcare proxy.
Yeah. And so they don't go, and healthcare proxy does not become activated until like you said, medical professional has determined that you lack capacity, so you're not losing control in that
Correct.
way, and they take that very seriously.
Yep.
When people fill out this form, and they are having two people witness it, not the person who they're putting as their agent and alternate,
Correct.
and then they're keeping that original.
Right.
And then they're making copies.
Right.
So talk about that for a second in terms of what to do. And like I said, if they are using an attorney, you're going to keep a copy too, but you're going to give them the original and such so that they can have it.
Yeah, when we do it, we give them the original, and we also give them a few certified copies so that they have multiples, and they can. If many people, again, especially older people, will give one to their primary care doctor, and they'll put it in their files, which is not a bad idea. But you always want to have the original, and if you lose it, if you've had a lawyer, the lawyer will have their own.
Yep.
They'll have a complete executed copy, and if you lose it and can't find it completely, then you just have to go get another one done.
Right. Yeah. Yeah.
Also important to note what you were saying before. So you're correct to say that you have to. The healthcare proxy is only going to come into effect when the medical people treating you say that it's coming into effect.
Yep.
But it doesn't mean it's always in effect at that point in time.
Correct.
You may have something that takes a couple of days, and then you get your ability to make decisions back. It goes right back to you.
Correct.
So you haven't lost your own ability. As long as you have the capacity, you will always be able to make your own medical decisions.
Absolutely. Absolutely. So the, like I said, you know, so when we're talking, so let's talk about durable power now, just in terms of the distinction, in terms of that.
So that's for, I always say to clients, that's for everything except healthcare.
Yeah.
So, you know, that's to help you deal with financial situations, banking, maybe something as simple as registering a car. Sometimes it's, these aren't as used as they used to be, but safe deposit boxes can give you the authority to go into a safe deposit box. Pretty much anything that you might do in life other than healthcare would be covered by a durable power of attorney. The other main difference between a durable power of attorney and a healthcare proxy, other than the substance of what it deals with, is that in most cases, the durable power of attorney will be effective immediately.
Right.
So that if something, and oftentimes they're used not just for incapacity purposes, but for convenience purposes.
Yes.
So this is particularly true when you might have elderly parents. Maybe they're in their late 80s, 90s, and maybe they're still completely mentally competent and physically healthy, and there's plenty more people in that age range that are today than there were many years ago.
Yeah.
But they also don't want to be doing all the things. They don't want to have to go to the bank to do something.
Right.
They don't want to be talking to the tax guy or the financial planning person. Yeah. And so the person that they appoint can help them with all those things. And you can have a conversation, you know, sometimes you can have a conversation between yourself, your appointed agent, and then the financial person, and the financial person can feel free to be, you know, fully conversant with the appointed person too. The reason that we generally don't make them so that they become active only upon incapacity is, number one, the first reason, what I just said. So you want to have them for convenience purposes. And number two, you would always have to have, it's easy with healthcare because the medical people are treating you. If you're using a power of attorney that only activates when you're incapacitated, you would always have to have an updated medical note of some kind that says the person is incapacitated. It becomes very cumbersome and difficult to use, and really no reason to. The only reason you would ever do this is if maybe, and I barely ever do it, but it's somebody that's really kind of gone outside of what who you would normally see. Again, the question that you asked before about somebody that's not that close to them. And so they want to have it in place just in case, but they really don't trust them.
Sure.
I said don't trust them. They just don't know them enough to trust them enough. And so they're a little bit leery of it. But it's a very unusual situation.
Sure. But this is where I say to people, now this document, I would only go through an attorney who is well-versed in elder law or estate planning.
Yes. So the healthcare proxy, hospitals, doctors' offices have forms that are completely compliant with the law. So it's okay. I have no issue with that whatsoever. There are no definitive one-size-fits-all forms for power of attorney. So you want to make sure that you go through it, make sure you understand what you're doing, have the correct information put in there. Maybe sometimes people they'll have a few things that they don't want their power of attorney to be able to do. So we can omit certain powers in that particular situation. So it is something that you do need. I think you need to definitely have legal assistance on that.
Absolutely. With the and if things and I want to go back to the healthcare proxy just for a second. If things change on that, again, it's important that people update it, because there does need updates at times. People update that and then replace the other documents, because sometimes, as you said, you go into a health institution, they might be handing this out, and you might have many of these documents. If there are several documents that are done.
So the first thing to always remember is the most recent document is the document that is legal.
Right.
But secondly, it still can create confusion if there are multiple documents out there, so you don't want to have that be in the situation. The most common reason somebody will come into the office to change either a power of attorney or a healthcare proxy will simply be because they need to change the person that they're appointing, either the primary or the backup, or maybe both. And what I always tell clients is to shred your old ones and these are now your documents. The old ones have no value anymore.
Yep.
They can only create confusion if they're out there. So shred them
Yep.
and get rid of them.
Yep.
And now this is the document. These are the documents that you're going to use from this point forward.
Yeah, perfect. So I know we have a very brief time left, but I just want to touch on this the living will piece, even though again not a legal document in the state, still an important guideline.
Yeah. So the living will, we don't have. Massachusetts doesn't have a statute still that discusses living wills. I think every other state does. Maybe one other, but it's still an important document because it still is evidence of what you want done. And this goes back to what we started off with in this show, is that you're really giving your direction if you are being kept alive by life support, that you do not wish to be kept alive by life support. And I mean, I'm oversimplifying it, but that's basically what it is. And even though it doesn't have statutory backing, so the absolute force of law, effectively it does the same thing because it's the evidence of what you wish to be done. And where trouble has happened in the past with these types of situations is when there's no evidence of what you want done, and then different family members have different views on it. Well, I don't want to take him or her off life support. And then somebody else says, I do want, because, and they both say, well, this is what they would have wanted. But you don't have the evidence, so you don't have, and now now, it doesn't happen often, but it can go into the court in order to decide what to do because family members are fighting about it. If you have this directive, if you have this living will that specifically states what you want, and it can also go into things like medication and comfort and dehydration and things like that, then it's all there, and that's usually going to be followed. It's pretty hard to overcome your statement of what you want. So even if there's a family member that says, and I don't blame this when it happens, but they're distraught by the situation, they want to keep them alive a little longer, maybe, this will supersede that. And so that's why it's important to still have, even though, again, we don't have the statute.
Excellent. Arthur, we can't thank you enough for being on the show today. How can people reach you?
You can reach me at the office. The phone number is 978-887-0093. Email is Skarmeas, so it's ASKARMEAS at skarmeaslaw.com. And that's how to do it.
Thank you so much. We really appreciate you being on the show.
Happy to do it.
And thank you all for tuning in to today's show, and look forward to having you at other ones in the future.
We don't focus on dying or how long they have left. We focus on whatever they want to do, whatever they can do, making sure that we can help them along.
Hospice care is really not just the physical care, but it's also the emotional and spiritual care as well. And we try to ease people into and through the process to hopefully make it as special and as meaningful a time for them as it can be.
It can be something much bigger than those final moments with someone. It can really help prepare the patient and family for eventual end of life. And I love that about it.